My name's Justin. I'm from Alabama. I always loved art. In 2009, I was diagnosed with schizophrenia. What's going on in my life right now is I'm going to school in fall for digital animation. I was inspired by Edgar Degas, Monet, but also like a lot of 90s animation and anime. But then as I started to get older, I kind of like gravitated more towards realistic type of stories. I work part-time doing security for concerts, football games. I paint on the side. I have involvement with my church. It's kind of like family. Everything is falling into place. Look at me now. My life during that time, back in 2009, I was serving in Boston, Massachusetts as a missionary and just started experiencing some things and had to come home to make sure I was healthy. I can't explain it, but I know I was feeling something psychologically. It took a toll on me. My thoughts on when I was first diagnosed were, well, what is it? I had never heard about it. Then they told me that it was a mental illness, and I had some ill feelings towards that, which is natural. I was taking pills. It's just kind of hard to keep up with trying to take pills, but I had to take it. I had multiple hospitalizations because I wasn't taking them regularly. That's why the nurse ended up advising me to take Invega Sustenna because he knew about my lifestyle and it was a good fit. When my nurse explained to me it was a once-a-month injection, I was game for it. I asked a lot of questions to my nurse and my doctors. Told me about Invega Sustenna. They went over the benefits and the side effects. I was on Invega Sustenna for a long time until I made my transition to Invega Trinza. It's just like taking Invega Sustenna, except you don't have to take it as often. The doctor explained to me that it was time released, so it's pretty much the same as Invega Sustenna. You know, you just don't have to take it as often. So the transition to Invega Trinza was very smooth and easy.
Justin's experience is unique to him. Each person's experience is different. Invega Sustenna, paliperidone palmitate, is a long-acting injection given by a healthcare professional once a month after 2 starting doses. Your doctor may adjust your dose monthly until you find the dose that is most effective for you. Invega Sustenna, paliperidone palmitate, is a prescription medicine given by injection by a healthcare professional. Invega Sustenna is used to treat schizophrenia. Invega Sustenna can cause serious side effects, including an increased risk of death in elderly people who are confused, have memory loss, and have lost touch with reality, dementia-related psychosis. Invega Sustenna is not for treating dementia-related psychosis. Invega Trinza, 3-month paliperidone palmitate, is a prescription medicine given by injection every 3 months by a healthcare professional and used to treat schizophrenia. Invega Trinza is used in people who have been treated with Invega Sustenna, 1-month paliperidone palmitate, for at least 4 months. Invega Trinza is the same medication as Invega Sustenna, but provides 3-month control of your schizophrenia symptoms in 1 dose. Invega Trinza and Invega Sustenna can cause serious side effects, including an increased risk of death in elderly people who are confused, have memory loss, and have lost touch with reality, dementia-related psychosis. Invega Trinza and Invega Sustenna are not for treating dementia-related psychosis. Do not receive Invega Trinza or Invega Sustenna if you are allergic to paliperidone, paliperidone palmitate, risperidone, or any of the ingredients in Invega Trinza or Invega Sustenna. See the end of the patient information leaflet in the full prescribing information for a complete list of Invega Trinza and Invega Sustenna ingredients. Please see the important safety information at the end of this video.
Now that I'm on Invega Trinza, it's impacted my relationship with my treatment team. What I talk about is my goals. My treatment team pushes for me to have goals in life, but I don't want them to do it for me because I'm just like an independent person. I know I don't have superpowers, but I know that I have 3 months of controlled symptoms. If I could go back with my treatment, I would change nothing. Everything that happened, it happened for a reason, I believe, and it just made me stronger. So it just keeps me going. So I kind of embrace challenges now.
The most common side effects of Invega Trinza include injection site reactions, weight gain, headache, upper respiratory tract infections, feeling restlessness or difficulty sitting still, slow movements, tremors, stiffness, and shuffling walk. Tell your healthcare provider if you have any side effect that bothers you or does not go away.
What I have coming up for this new school year is I take one class a term because I don't want to put too much on my plate right now. And I also work part-time. Having 3 months of control for me means that when that mood comes and I feel like painting, I can just dive right into it. I actually painted my first painting that I was satisfied with. It was very colorful. I ended up selling it. My name is Justin. I'm from Alabama, and I'm on Invega Trinza.
Indication. Invega Trinza, 3-month paliperidone palmitate, is a prescription medicine given by injection every 3 months by a healthcare professional and used to treat schizophrenia. Invega Trinza is used in people who have been treated with Invega Sustenna 1-month paliperidone palmitate for at least 4 months. Invega Sustenna, paliperidone palmitate, is a prescription medicine given by injection by a healthcare professional. Invega Sustenna is used to treat schizophrenia in adults. Important safety information. What is the most important information I should know about Invega Trinza and Invega Sustenna? Invega Trinza and Invega Sustenna can cause serious side effects, including an increased risk of death in elderly people who are confused, have memory loss, and have lost touch with reality, dementia-related psychosis. Invega Trinza and Invega Sustenna are not for treating dementia-related psychosis. Do not receive Invega Trinza or Invega Sustenna if you are allergic to paliperidone, paliperidone palmitate, risperidone, or any of the ingredients in Invega Trinza or Invega Sustenna. See the end of the patient information leaflet in the full prescribing information for a complete list of Invega Trinza and Invega Sustenna ingredients. Before you receive Invega Trinza or Invega Sustenna, tell your healthcare professional about all your medical conditions, including if you have had neuroleptic malignant syndrome, NMS, have or have had heart problems, including a heart attack, heart failure, abnormal heart rhythm, or long QT syndrome, have or have had low levels of potassium or magnesium in your blood, have or have had uncontrolled movements of your tongue, face, mouth, or jaw, tardive dyskinesia, have or have had kidney or liver problems, have diabetes or have a family history of diabetes, have had a low white blood cell count, have had problems with dizziness or fainting or are being treated for high blood pressure, have or have had seizures or epilepsy, have any other medical conditions, are pregnant or plan to become pregnant. It is not known if Invega Trinza or Invega Sustenna will harm your unborn baby. If you become pregnant while taking Invega Trinza or Invega Sustenna, talk to your healthcare professional about registering with the National Pregnancy Registry for atypical antipsychotics. You can register by calling 1-866-961-2388 or visit http:// womensmentalhealth.org/clinical-and-research-programs/pregnancy registry. Infants born to women who are treated with Invega Trinza or Invega Sustenna may experience symptoms such as tremors, irritability, excessive sleepiness, eye twitching, muscle spasms, decreased appetite, difficulty breathing, or abnormal movement of arms and legs. Let your healthcare professional know if these symptoms occur. Are breastfeeding or plan to breastfeed? Invega Trinza or Invega Sustenna can pass into your breast milk. Talk to your healthcare professional about the best way to feed your baby if you receive Invega Trinza or Invega Sustenna. Tell your healthcare professional about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Know the medicines you take. Keep a list of them to show to your healthcare professional or pharmacist when you get a new medicine. Patients, particularly the elderly, taking antipsychotics with certain health conditions or those on long-term therapy should be evaluated by their healthcare professional for the potential risk of falls. What should I avoid while receiving Invega Trinza or Invega Sustenna? Invega Trinza and Invega Sustenna may affect your ability to make decisions, think clearly, or react quickly. Do not drive, operate heavy machinery, or do other dangerous activities until you know how Invega Trinza or Invega Sustenna affects you. Avoid getting overheated or dehydrated. Invega Trinza and Invega Sustenna may cause serious side effects, including C. What is the most important information I should know about Invega Trinza and Invega Sustenna? Stroke in elderly people, cerebrovascular problems that can lead to death. Neuroleptic malignant syndrome, NMS. NMS is a rare but very serious problem that can happen in people who receive Invega Trinza or Invega Sustenna. NMS can cause death and must be treated in a hospital. Call your healthcare professional right away if you become severely ill and have any of these symptoms: high fever, severe muscle stiffness, confusion, loss of consciousness, changes in your breathing, heartbeat, and blood pressure. Problems with your heartbeat. These heart problems can cause death. Call your healthcare professional right away if you have any of these symptoms: passing out or feeling like you will pass out, dizziness, or feeling as if your heart is pounding or missing beats. Uncontrolled movements of your tongue, face, mouth, or jaw, tardive dyskinesia. Metabolic changes. Metabolic changes may include high blood sugar, hyperglycemia, diabetes mellitus, and changes in the fat levels in your blood, dyslipidemia, and weight gain. Low blood pressure and fainting. Changes in your blood cell counts. High level of prolactin in your blood, hyperprolactinemia. Invega Trinza or Invega Sustenna may cause a rise in the blood levels of a hormone called prolactin, hyperprolactinemia, that may cause side effects including missed menstrual periods, leakage of milk from the breasts, development of breasts in men, or problems with erection. Problems thinking clearly and moving your body. Seizures. Difficulty swallowing that can cause food or liquid to get into your lungs. Prolonged or painful erection lasting more than 4 hours. Call your healthcare professional or go to your nearest emergency room right away if you have an erection that lasts more than 4 hours. Problems with control of your body temperature, especially when you exercise a lot or spend time doing things that make you warm. It is important for you to drink water to avoid dehydration. The most common side effects of Invega Trinza include injection site reactions, weight gain, headache, upper respiratory tract infections, feeling restlessness or difficulty sitting still, slow movements, tremors, stiffness, and shuffling walk. The most common side effects of Invega Sustenna include injection site reactions, sleepiness or drowsiness, dizziness, feeling of inner restlessness or needing to be constantly moving, abnormal muscle movements, including tremor, shaking, shuffling, uncontrolled involuntary movements, and abnormal movements of your eyes. Tell your healthcare professional if you have any side effect that bothers you or does not go away. These are not all the possible side effects of Invega Trinza or Invega Sustenna. For more information, ask your healthcare professional or pharmacist. Call your healthcare professional for medical advice about side effects. You may report side effects of prescription drugs to the FDA at 1-800-FDA-1088. General information about the safe and effective use of Invega Trinza or Invega Sustenna. Medicines are sometimes prescribed for purposes other than those listed in a patient information leaflet. Do not use Invega Trinza or Invega Sustenna for a condition for which it was not prescribed. Do not give Invega Trinza or Invega Sustenna to other people, even if they have the same symptoms that you have. It may harm them. You can ask your pharmacist or healthcare professional for information about Invega Trinza or Invega Sustenna that is written for healthcare professionals. This patient information leaflet summarizes the most important information about Invega Trinza and Invega Sustenna. If you would like more information, talk with your healthcare professional. You can ask your healthcare professional or pharmacist for more information that is written for healthcare professionals. For more information, go to www.invegatrinza.com or www.invegasustenna.com or call 1-800-526-7736. Please read the accompanying full prescribing information, including boxed warning for Invega Trinza and Invega Sustenna, and discuss any questions you have with your healthcare professional.